Online Health Information by Ashley Menace. Hi there, my name is Ashley Menace and I'm a third year psychology major at the best university in the nation. You guessed it, UT. I'm an Austinite from birth and I'm here to shed some of my wisdom about online health information. On your bottom right, you can see me in my thinking pose ready to share some of my knowledge. So, why is this even relevant? As a psychology major, health information is not only vital to my field, but it is extremely important in my everyday life. So, let's say you start feeling sick. Is it safe for you to turn on your computer, head on over to your handy dandy doctor, WebMD? WebMD provides a cheap and quick outlet for all of your medical needs. They also have this handy dandy symptom checker that will most likely diagnose you with something far more serious than what you really have. Just kidding. But you really do need to be careful. So you can see I included a screenshot of what it looks like. So you would just have to go in there and input some information about how you're feeling, just diagnostics about yourself. And then it would shoot back just a list of things that might possibly be wrong with you. But when in doubt, always seek a real doctor out. So let's get into the interesting stuff. So 1 in 3 American adults have gone online to figure out a medical condition. That's, to be exact, it's 35%. Another interesting fact is that women are most likely than men to go online to figure out a possible diagnosis. 41% of online diagnosers say a medical professional confirmed their diagnosis. An additional 2% say a medical professional partially confirmed it. 35% say that they did not visit a clinician to get a professional opinion at all. 18% say that they consulted a medical professional and the clinician either did not agree or offered a different opinion about the condition. Lastly, 1% say that their conversation with the clinician was inconclusive. Crazy to think that all of these things are constantly going on and people are constantly turning to online resources for medical needs. So now let's get into another perspective of online healthcare, which is peer-to-peer healthcare, meaning people go online to seek out other people who are going through the same things that they are. So number one, among online health information seekers, 16% in the past year tried to find others who might share the same health concerns. 2. 30% of internet users have consulted online reviews or rankings of healthcare services or treatments. 3. 26% of internet users have read or watched someone else's experience about health or medical issues in the past year. So not only are people going online to check out what they have, but they are also going online to research other people who are going through the same things, kind of just networking, trying to figure out things that would make the illness better or just symptoms that other people have that might compare to you. So you might be wondering, how does this affect us? This online hemisphere is opening up mounds of new opportunities that were never available before. But with all these newfound medical sites, you have to know how to sort out all the good from the bad. Here's a simple checklist on on steps on how to know your information is reliable. So, one of the first questions is, can you easily see who sponsors the website? So usually .gov identifies a government agency, .edu identifies an educational institution such as a college, university, or anything of that sort. .org usually identifies a nonprofit organization, and .com is associated with the commercial site. So, which leads us to the next question. Is the sponsor a government agency, a medical school, reliable health-related organization, or is it related to one of those? So you really have to know what site you're on and who's put that information on there. So is there contact information? Can you see if there was a doctor that was involved in putting all this information? And also another important thing is, can you tell when the information was written? It is vital to make sure that the information is up to date. You don't want to be basing your healthcare needs on something that's been out of date for a couple of years, because then not only is that harming you, but you're not getting reliable information at all. And is your privacy protected? You can never just assume that your privacy is being protected if you're inputting your personal information into a specific site. So you just want to make sure that you're never sharing anything extremely personal on any site that's not reliable. And does this website make claims that seem to be too good to be true? Are they trying to make you buy a specific product? Um, Signs like that are never good because they're just trying to advertise a specific product for a specific thing. So, health technology now. So, shifting gears, let's talk about how all this great innovation is changing and the ways doctors handle patients. So, in 2010, Gutman launched HealthTap, an online service that makes it just as easy to get answers to your health questions from a real trusted doctor. So, as you can see, I included a picture of what the actual app looks like. For $99 a month, this site will provide you with around the clock access to a physician who can answer all your health care inquiries. So, if one day you would wake up feeling sick and you just want to talk to a doctor about what's going on, you can just go on this app and a doctor will be right with you. So, this video conferencing tool is expected to reduce doctor visits and make care less costly. So, instead of actually having to go and schedule a doctor visit, you can just go on this app, video conference with the doctor, and decide if it's necessary to even make an actual doctor's appointment and go into a doctor's office. And they also had the patient's privacy in mind, which is extremely important because the entire platform is secure and encrypted, so even the engineers can't see the information. So the face of patient care is changing and innovation is emerging in every corner, and even doctors' offices all around the nation are shifting from paper files to digital files about patients. So everything is being submitted electronically, which not only makes it easier for the doctors to keep up with, but it also puts your privacy at risk just because anyone can log into the system and just bring up your information. Opposed to when paper files were kept, you had to have access to those specific files. So lastly, I leave you with my last piece of advice. Think safe and stay healthy. Till next time, love Ash.